It's one of the most urgent questions of our time. Can Alzheimer's be prevented? In our town hall featuring world-renowned neurologists, leading researchers, and families on the front lines, we'll explore how blood-based biomarkers are changing early diagnosis, how gene therapy and anti-amyloid drugs are showing promise, and why precision medicine is reshaping prevention and care. We'll also identify lifestyle changes that are making a difference. Mind over matter, taking action against Alzheimer's and dementia. Next.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.
Welcome to Mind Over Matter, taking action against Alzheimer's disease and dementia. It's a town hall you don't want to miss. I'm Olga Villaverde. The number of Americans estimated to develop some form of dementia, especially Alzheimer's, is expected to double over the next several decades. So the question is, can this disease be prevented? The Alzheimer's Association recently released a report detailing the state of the Alzheimer's and dementia crisis in this country. Here's a video that lays out some of the facts and figures. There are new drugs, many different therapies, and lifestyle changes, but will they actually prevent the slow decline of this disease? That's our focus in this town hall. But first, what exactly is dementia? It's not one specific disease, but a group of symptoms that causes a decline in mental ability and interferes with daily life. There are different kinds of dementia, and each form has a different cause. The most common form of dementia is Alzheimer's disease. Other types include vascular dementia, Lewy body dementia, frontotemporal dementia, and mixed dementia. We're going to take a look at all these forms of dementia later, but now I'd like to introduce our fabulous panel. Joining us in the studio is Dr. James Galvin. He's the director of the Comprehensive Center for Brain Health at the Miller School of Medicine, which is part of the University of Miami. Joining us from New York is Dr. Jeffrey Borenstein, President and CEO of the Brain and Behavior Research Foundation, and also the host of Healthy Minds, which airs on PBS stations around the country. Dr. Corinne Las Mesas is the director of the David and Lynn Nicholson Center for Neurodegenerative Disease Research at Florida Atlantic University. Jay Mikosh is the campus executive director at Lisbeth Memory Care. And finally, Kitty Lundan. She's a TV host and caregiver for her mother. Welcome to all of you. Kitty, I'd like to start with you if you don't mind. Caring for someone with Alzheimer's requires so much patience and compassion. Could you please tell us your story?
Yeah, so it started basically around the pandemic. I noticed changes in regards to questions that were repeated questions, just really not herself. And so at first I thought it was just older age. People said, when you age, you act different, you may repeat yourself. But then I realized that it was a little more than that. And so I started doing a little research, and I said to myself, Kitty, you need to get your mom checked out because this is not normal. And so we went to a neurologist, and she was diagnosed at that time with dementia.
I can imagine at that moment when you heard that, Kitty, your thoughts.
It was life-changing for both of us. To think that you're going to never get better. It's not a diagnosis that you want to hear. This disease kind of just gets worse. So yeah, very devastating.
All right, and we're going to talk more to Kitty about being a caretaker and what she does to keep the support and the hope alive. Dr. Las Mesas, let me ask you something. The number of people with Alzheimer's is expected to rise as today's younger middle-aged people grow, right, into their senior years. So my question to you is it solely the fact that our population is aging, or are there other reasons for the expected increase in these numbers?
Age is the reason for this increase. I mean, by 2030, all baby boomers will be 65 and more.
Right.
And the rate between 65 and 74 is 5% have Alzheimer's. The next decade, it's 13%, and 85 and older, it's 33%. So it's really age. Actually, the number of new cases per age group is on the decline because people are becoming more conscious about possible life interventions, and so which is a very positive trend.
Dr. Borenstein, let me bring you in. We all know that lifestyle is a huge part of being healthy, but what role does it play in preventing or maybe slowing the progress of Alzheimer's, or does it make a difference at all?
Makes a big difference. So lifestyle is crucial for our health across the board. And basically, lifestyle changes that are good for the heart are also good for the brain. So exercise, social interactions, diet, in particular the Mediterranean diet has been found to be very useful. These are steps that we all can take, and anything that makes your heart healthy is going to make your brain healthy and delay the onset or even avoid the onset of a dementia.
Great information. Okay, so Dr. Galvin, I was reading here, you've used the analogy of a bank account when it comes to saving up for the potential deficits of Alzheimer's. So can you explain how that works? I was fascinated by that.
Well, if you think about it, when you save up for your financial future, you collect all your resources and you're getting ready for the time that you're going to retire, so that you have a reserve of financial funds to live a healthy life. Well, just like my colleague just said, if you eat well, exercise, stay socially active, mentally active, you start to build cognitive reserve. You're building your capacity to resist the effects of age and maybe not develop Alzheimer's disease. We heard statistics, 5, 18, 33% get disease, but that means that 95 and 72 and 67% of people do not. And those people who build capacity are going to do better.
Great point there. Thank you, Doctor. Jay, Alzheimer's patients often feel isolated and lonely. And Kitty, I'm going to bring you in just a moment to talk about that. But Jay, how do you and your team deal with that? And what tips for caregivers and family? Because the isolation has got to be tremendous.
It is tough. It really is about individualizing the care for the person with Alzheimer's, and really understanding what are the things that they enjoy that bring meaning to them, that bring a smile to their face. So it could be music, it could be art, it could be a favorite food, but really spending time with the families, getting to know what's important to their loved one, and then making those a part of the interactions with the loved one. So singing a favorite song, putting on a favorite music genre, or getting out a photo album and looking at past memories of families and friends can really help with isolation and loneliness.
Kitty, let me ask you this. Is this something that you do? Does it make a difference when your mother hears the music or sees pictures? I know she goes to an adult daycare. And has that helped her as well? Lots of questions there. My apologies.
No problem. Well, it's basically helped both of us. I work from home, so all day I was dealing with the different variations of mood swings and just trying to get her to calm down sometimes, yes, but music, I learned, is a therapy. Music and distractions is what they call it. Making sure that, when she goes left, I try to get her right, no pun intended. But, doing everything in my power just to try to keep her as calm as possible. And I had to learn a lot myself to try to make sure I do the countdown, because it's hard on caretakers. I mean, we're new at this. No one planned to take care of their mom.
Great point there. And we talk so much about the patient and not enough about the caretaker. I appreciate that. So we know Alzheimer's physically makes changes in the brain, and they can be identified with what's called biomarkers. We have a video that helps explain what biomarkers are and how they work. Take a look at this.
In healthy people, the brain contains tens of billions of nerve cells called neurons. All sensations, movements, thoughts, memories, and feelings are the result of signals that pass through these cells. Neurons communicate with each other using electrical charges that travel through the cell, causing the release of chemicals across tiny gaps to neighboring neurons. Other cells in the brain, such as astrocytes and microglia, clear away debris and help keep neurons healthy. In a person with Alzheimer's disease, toxic changes in the brain destroy healthy communication among neurons. These changes may occur years or even decades before the first clinical signs, such as memory loss. In Alzheimer's disease, researchers believe this process primarily involves two proteins, beta-amyloid and tau, which build up and become toxic to brain cells. As abnormal tau accumulates, it eventually forms tangles inside neurons. Beta-amyloid clumps into plaques, which slowly build up between neurons. As the level of amyloid reaches a tipping point, there is a rapid spread of tau throughout the brain. Research continues to evolve rapidly toward effectively preventing and treating Alzheimer's disease. To learn more about Alzheimer's disease and the brain, visit alzheimers.gov.
Dr. Las Mesas, that video laid out how biomarkers disrupt brain function. How do those changes affect the brain, and what, if anything, can be done to stop or at least slow down the progression?
Sure. So the two biomarkers that were shown in the video are A-beta, it's called amyloid beta fragment, and tau. These are actually more than biomarkers. They reveal the disease, but they actually cause the neuronal disruption. These are two proteins that we all make. In the disease, the problem is that they change shape. Each protein needs to have a particular shape to do its function. When they change shape, they start making clumps. And these clumps are toxic to the neurons. They literally go attack the neurons and induce dysfunction and neuronal death. So since we've understood that, that has been a major advance in the field. And the way we can intervene is to prevent these proteins to change shape, to prevent them from forming clumps, or to make the neurons resistant to the attack by these proteins. So there are several points of intervention that are possible here.
Thank you, Doctor. Dr. Galvin, I have a question from a viewer, and it's from Anne in Boca Raton. Thank you, Anne, so much. She writes here, my husband has Alzheimer's and has participated in clinical trials in the past. They have worked for him. He's much better, and that's great to hear. Anne, are clinical trials the way out of this disease? Great question, Anne. Thank you so much.
That is a great question. Every medicine that's approved today has gone through a clinical trial.
Agreed.
Without a clinical trial, there will not be medicines. Without wonderful people like Anne's husband who participate in clinical trials, no medications would be approved. Right now, there are over 162 clinical trials testing over 158 different agents.
Wow.
So if you're interested, there are websites, clinicaltrials.gov, where people can find out the trials that are ongoing and if they possibly would be eligible to participate.
Great information. Again, thank you, Anne. Dr. Galvin, I was reading here also, so I'm going to follow up with this if you don't mind. These changes in the brain can begin 3 years, 10 years, or even decades before symptoms appear. That's kind of scary if you ask me. So what precautions should people take, if any, to see if they have Alzheimer's in the family?
Well, Alzheimer's by and large is not a genetic disease, so it's what we call sporadic. It occurs randomly in the population.
And that was my follow-up question, so thank you for clarifying that.
But there are risk factors for developing Alzheimer's disease. And so if people have risk factors, some of them are modifiable. If you have high blood pressure or diabetes, control your disease. If you smoked, stop smoking. If you have hearing loss, get a hearing aid. If you have visual problems, get your eyes checked, right? And then the other things are, these biomarkers allow us to potentially find out very early.
Okay, thank you so much, doctor. So women, since we're talking about risks, besides the usual risk factors, there are some Americans who are more likely to develop Alzheimer's than others. So women make up about 2/3 of all Alzheimer's patients. They are twice as likely as men to develop Alzheimer's in their 60s. More than 60% of caregivers are women. And according to the latest numbers from the Alzheimer's Association, look at this, Black Americans are about twice as likely to develop the disease than whites, and Hispanics are about 1.5 times more likely to get the disease. So Dr. Bornstein, let me bring you in right now. We know women tend to live longer than men, and that can play a role in the higher number of Alzheimer's diagnoses. But are there other factors involved here, sir?
We don't yet know, but probably there are, and it could be hormonal factors. So I think this is something that people should be aware of and be thinking about, speaking with their own doctors about it. Hormone replacement therapy, there really isn't a good answer to whether or not people are better off with it or without it in terms of Alzheimer's. So it's something to really work with your own doctor about. And I think the statistics you gave about Black and Hispanic people probably speak to some of the disparities that exist in our healthcare system for those groups, and addressing those disparities, making sure that people do receive treatment for high blood pressure, for high cholesterol, for diabetes, etc., are able to have a healthy diet. I think that would make a big difference as well.
Thank you, Dr. Bornstein. Dr. Lesmesas, I want to follow up on what Dr. Bornstein just talked about, hormone therapy. Like, I'm going through menopause, full disclosure, transparency, and I've thought of HRT, hormone replacement therapy. I hear these things and I wonder, okay, is it harmful? Can I develop Alzheimer's? Along with other things that are, risk factors as well. But what do you say?
So there are clinical studies, and what they show so far is that early hormone replacement therapy, like in the 50 years old or so, tend to have a beneficial effect and delay Alzheimer's, whereas later hormone replacement therapies around 65 tend to actually be detrimental. So again, there is never an easy answer to that. But a hormone is not the only explanation for this. There might be other factors, such as the fact that, for example, diabetes. There are less women than men who have diabetes, but when they have it worse. They have more cardiovascular complications, for example, and these are risk factors for Alzheimer's. Women tend to have a little bit more chronic inflammatory conditions, again, another risk factor for Alzheimer's. So there's a lot of research being done to understand these factors better, and we hope to take measures as we go in our understanding of these risk factors.
Thank you, Doctor, very much. Kitty and Jay, I'm going to follow up with you on this as well. Talking from a caregiver's perspective, right? Because we need to talk about the caregiver. What was your biggest challenge when you first started helping your mother? And what advice can you give others who may just be starting the journey right now?
I think one of the hardest things were actually for both of us to realize that this disease was real and we both were facing these challenges. As much as my mom wants to be independent, we realize that she does have things that she needs help. And so taking some of those things away from her, like she can't drive anymore. I'm pretty much, her Uber driver. Administer her medicine because she'll forget to take it. So those things and losing, her independence was very hard and very difficult for me as well, because my mom has always been independent. So me getting in that caretaker role, it's still to this day, sometimes I wake up and I'm like, I can't believe that this is my mom. Like at 80 years old, I envision her to be, just playing bingo and hanging out with her friends and living the best life. And that's not what we were given. As far as our cards were not dealt that way. What I would tell anyone is, first, don't be in denial. If you see something, say something. Get to your caregivers, doctors early. don't brush it off as it's just age or this is normal, because usually it's something that is going to progress. And get as many resources, listen to shows like this, because there's so many resources out there, and I wish I would have known earlier, but I'm here now learning from each and every one of you all, and trust me, I'm taking it, because our journey's not over. It just began, really, and so I need all the assistance that I can get as a caretaker.
Thank you, Kitty. And you know, Jay, I hear her and I think of my mother. My mom is 80 years old and she drives and she still goes to Tai Chi and a book club and, you know, restaurants. And I can't imagine all of a sudden going through this journey, what Kitty's talking about. How do you help caretakers who go through this and also need help as well? Absolutely.
It's really a conversation with them, and an individual conversation about their experience and what they're dealing with, and getting to know them, getting to know their circumstances. And Kitty said so well, there are so many resources out there. And when someone has a concern, and often they do attribute it to normal aging, and they think, oh, you know, it's something that everyone goes through. But you know, when caregivers start to identify a concern, they should reach out and get help. And have a physician involved and look into the situation, because maybe it is normal aging, but maybe there is more involved. So we're here. It's a community. There's so many resources and support available to people. They just they need to seek them out.
Absolutely. Thank you, sir. Dr. Galvin, much of your research focuses on improving care and the quality of life for adults and their caregivers from diverse backgrounds. So my question to you is, were you surprised with those numbers that we showed that Blacks and Hispanics are more likely to get Alzheimer's than whites? And what are some of the obstacles they face in the community?
Yeah, I mean, this is a big question, right? And I think Dr. Borenstein touched upon part of it. You know, people from minority backgrounds, African Americans, Hispanics, people who live in rural communities, American Indians, Pacific Islanders, they seem to be at a higher risk. They develop the disease at an earlier age, but they come to diagnosis at later stages. They have many more vascular risk factors, so they have a much higher risk profile than majority populations. And this isn't just a midlife problem. This goes back to early life, right? So access to care, access to nutrition, quality education, all those things that are social determinants of health from early life then set you up for medical determinants of health in midlife, which sets you up for bad health outcomes in late life. Alzheimer's, heart disease, diabetes, strokes. So it's a big social problem. It's not easy to address, but I think my research and other researchers in the field are trying to figure out how we can influence policy.
Thank you, doctor. So there are other factors involved in who may develop Alzheimer's. Your family can play a huge role. Take a look at this video.
In terms of family traits, Alzheimer's disease has two main types, says Dr. Ronald Peterson.
There's one form that's truly inherited in what's called an autosomal dominant fashion.
In this type, each child of a parent with Alzheimer's has a 50% chance of inheriting the mutated gene, which leads to early onset Alzheimer's. But that is only 1% of all Alzheimer's disease.
The vast majority, though, still has some hereditary influence. So, like many other diseases, Alzheimer's disease can run in families. So if you have first-degree relatives with Alzheimer's disease, your risk may be up 3- or 4-fold over the general population.
While the risk is increased, it doesn't mean you'll develop the disease. Dr. Peterson says to stay involved in intellectual activities like reading or playing chess and being socially active.
Don't withdraw, don't avoid going out. Stay involved.
Follow a healthy diet, get plenty of rest, and find ways to reduce stress.
And I think the combination of all these factors may improve your quality of life and perhaps could postpone any cognitive impairment.
For the Mayo Clinic News Network, I'm Dee Dee Stiepen.
Great video there, Dr. Borenstein. So we've talked about how important lifestyle changes are, but in the video it mentions that Alzheimer's can run in families even if they don't have that mutated gene. So what would cause that?
As is the case with other conditions. It could be multi-genetic, if not just one gene, but these things are inherited. So I would say for people who have a family history of Alzheimer's in a sibling and a parent, they are at greater risk, as was described in the video, those people should be even more careful than the general population in terms of diet and exercise and other precautionary measures such as cholesterol, hypertension. They should be extra careful about those issues. If we delay the onset, the good news for all of us is if we delay the onset by 5 or 10 years, it makes a big difference. I'm just thinking of Kitty and her mom. If this happened in 10 years from now, it would be a lot different. So delaying it, even if it still happens, can make a big difference for the individual.
Dr. Lesme says, let me continue with that thought, and thank you, Dr. Borenstein. What is that early onset Alzheimer's? What does it look like, and how is it different?
So what early onset Alzheimer's disease, EOAD, means is a person who gets Alzheimer's disease before the age of 65. In many cases, we don't know why, and it's called idiopathic. And in some cases, it's genetic. Again, many genes are not known that would create a EOAD, but some of them are known, 3 in particular, APP, PSEN1, and PSEN2. And in these families, family members develop Alzheimer's disease between the age of, let's say, 25 and 70. And there are other factors involved, and not everybody has the same resiliency. In the same family, with the same mutation in the same gene, some people will develop Alzheimer's at age 25 and others at age 65.
25. Wow, that's very young. So Jay, what signs or symptoms should family members or caregivers be concerned about with a family member? Because I'm in my late 50s and I'm starting to forget where I kind of put the other day, where are my glasses? They were on top of me. I couldn't find my keys. I think that's kind of just probably the stress of life. But what signs and symptoms should you be aware of?
Sure, Kitty.
Where there's an aha moment, like this is getting serious.
Sure. Kitty gave some great examples as well. So the repetitive questions, the
over and over.
Repetitive stories, absolutely. Did I tell you? When you've heard that story 2 or 3 times. Those sort of changes, behavioral changes, some agitation, also difficulty with numbers. Maybe they were, did really well balancing their checkbook and or remembering dates, specific dates and events. So, many folks are very aware of their next doctor's appointment or other appointments, but suddenly they begin to forget. So those are some telltale signs that something may be going on, and they absolutely should reach out for help.
So Kitty, thank you, Jay. Did you notice things like that too, like an important date, or like he talked about the repetition over and over again, or just things that you would have never heard your mom say?
Yeah, it did. It started off, I hate to use the terminology, the parrot, right? But it started off with the repeating, and telling me something like you've never told me before. And at first I would be like, yeah, I'd play along with it. But then I would like, you know what? No, this is not right. And I know that sometimes life happens. And like you said, leaving the glasses, getting stressed. But when you don't know the year, you don't know the president anymore. You don't know just where you stay anymore. Now it's to the point where I have to remind my mom of who I am. And I am the only child. So could you imagine, having to tell your mom, like, I'm your daughter.
I'm your daughter.
I'm not your mom.
I can't even imagine.
I'm your daughter.
I can't even imagine
and
that
so,
feeling of telling your mother, I can't even imagine me telling my mother, I'm your daughter.
I know.
That's so
when I first had to
frightening.
do that, it was devastating because my mom always knew who I was. I'm her only child, I'm her baby. Going through those things and learning just how to live through those moments, it's a learning journey every day. And I promise you, after this call, I'm going to get on the Mediterranean diet because I'm going to get scared straight. I need to figure out everything possible so I can delay this. Hopefully I'll never get it, but it's not in my favor because my mom has it. So
I completely understand. Thank you so much for sharing these stories, Kitty. I really appreciate it. Dr. Borenstein, I'd like to share a question that I got from George in Boynton. Thank you, George. It's kind of aligned with exactly what we're talking about right now. My dad has Alzheimer's disease. He's doing okay with it, but he's had it now for more than 10 years. Now he's remembering things that never happened. Your thoughts, Dr. Bornstein?
Yeah, again, I feel my heart goes out to anybody who has a loved one with this condition. Often this can occur, and sometimes along with the memory disturbances and that we've heard can be behavioral disturbances. Sometimes people can have what we call psychotic episodes, where they may hear voices, see things that are not there. They may become paranoid, and they may, in addition to not recognizing their child, as has happened with Kitty and her mom, they may become afraid of their caregiver. They may become agitated towards the caregiver. Fortunately, there are treatments to help with some of these behavioral symptoms. So if your loved one is experiencing that, that's a time to really get help, and with medication and potentially other interventions to make a difference in the life of the caregiver and, of course, the person.
Thank you, Dr. Bornstein. Jay, you were nodding your head a lot and acknowledging what Dr. Bornstein was saying. Could you add some thoughts there?
Just the behavioral changes and the effects that it does have, absolutely, can be very devastating and very challenging for family members and caregivers. And I see it all the time, in the communities that I've been involved with. It really is a difficult experience.
Okay, thank you, Jay. So there have been some breakthroughs and advancements lately in the diagnosis and treatment of Alzheimer's. One of them is a recently approved blood test to diagnose the condition. So Dr. Galvin, can you tell us a little bit more about this?
Yeah, so these proteins we talked about before, the amyloid protein, the tau protein, traditionally we could only measure them in spinal fluid or by very expensive PET scans. But more recently, there have been blood tests that have been developed, and the most recent test is for something called phosphorylated tau 217, or p-tau 217. And this protein abnormality, which is elevated in the person who has Alzheimer's disease, really aligns very well with the changes that are going on in the brain. So it's the first approved diagnostic in blood. And so we can use this now when we're evaluating a patient who we think have Alzheimer's disease. Before, we can never really be sure. Now we can be pretty sure with a simple blood test.
That's fantastic to hear. Dr. Les Mesas, I was also reading here that 2 drugs were approved by the FDA within the last few years, and they show promise in slowing the progression of Alzheimer's. Again, that's slowing it down. So, Doctor, what type of drugs are we talking about, and how do they work? If you could share, please.
Yes, so these drugs are Leqembi and Kisunla. And what they are antibodies. Antibodies are big molecules that our immune system makes naturally, for example, in response to a viral infection. In this case, they're engineered and they're injected by intravenous route in the patients. These antibodies bind to A-beta fragments, to these protein clumps we were talking about earlier. They bind to them and they help the brain cells eliminate them. And so by reducing the amount of these A-beta clumps, it slows down the progression of the disease, very logically so.
Are there any risks involved with these?
So there are infusion-related risks, that's the major risk, and there is another risk that is called ARIA. ARIA is amyloid-related imaging abnormalities. And what this means is that when you do an MRI scan of the patient, it can be that the doctors observe edema or even very small hemorrhages. And this is because by stripping the amyloid beta from around the blood vessels, it makes them a little bit leaky and can lead to brain edema. So most of the time it's asymptomatic and it's detected by an MRI scan, but in this case the treatment has to be interrupted.
Doctor, thank you so much. So getting an early diagnosis of Alzheimer's is obviously important, and artificial intelligence could play a role. Take a look at this video.
Mayo Clinic neurologist Dr. David Jones compares electrical activity in the brain to a noisy crowd. Sometimes everyone cheers at once.
All the neurons, occasionally they'll synchronize and they'll come together, and we can see those like waves across the brain.
A test called an electroencephalogram, or EEG, looks at brain waves of patients with neurologic problems.
These waves kind of slow down. They look a little bit different in people who have cognitive problems.
Dr. Jones and a team of researchers are using artificial intelligence to assist staff in analyzing EEGs for early identification of brain disorders. The team found AI can help detect EEG patterns and measure them.
Patients with cognitive problems like Alzheimer's or Lewy body disease had very different brainwave patterns.
EEG is more widely available globally than other brain scans. With AI helping clinical teams review EEG, early evaluations for Alzheimer's and other neurodegenerative diseases may become more accessible.
We do believe diagnosing early and accurately is one of the best ways to provide the best possible medical care.
For the Mayo Clinic News Network, I'm Joel Streed.
And there's another avenue of research that deals with one of the first symptoms of Alzheimer's, the changes in short-term memory. While a lot is known about short-term memory, there's still much to learn, especially the pathways between short-term and long-term memories. Take a look at this video.
Throughout our lives, we have countless experiences. Most we quickly forget, but a few stay with us for days, months, or even years and shape our thoughts and actions. Our brain works diligently to record our everyday experiences into memories, creating representations of events that stay with us for short periods of time. These short-term memories are stored in what we can think of as a temporary gallery in our brain before being cleared out for representations of new experiences. Only a small fraction of these representations, those that are most meaningful to us, are then included in a more permanent gallery, our long-term memory, that we can access days or years later. Scientists have long believed that in order to create a lasting memory, a short-term memory of an experience had to be created. The only way for an experience to be included in the permanent gallery was to be moved there from the temporary gallery. But our recent research has turned this idea upside down. Long-term memory can form without short-term memory. When we temporarily turn up the activity of a specific protein called CAMK2, we prevented the short-term memory of an experience in an animal. However, days later, the animal surprisingly had a long-term memory of that experience. This finding is like discovering a secret pathway to the permanent gallery in the brain. We now think there are two parallel paths to memory formation, one for short-term memories and another for long-term memories. This means our brains might be more resilient than we thought. Understanding these separate paths could be key to understanding memory loss in conditions like Alzheimer's. By uncovering how memory is formed in the brain, we are unlocking new possibilities for preserving our minds for years to come.
So, Dr. Galvin, if there are other pathways to long-term memories, how would that affect Alzheimer's patients?
Well, it's a great question, and I don't know that there's a clear answer to that question. I think, there's an expression, all roads lead to Rome. And the idea is that there might be a lot of different pathways to get to a final common point. Clearly, in mice, they can learn even with their short-term memory blocked. In patients, they can recall things that, that happened many, many years ago, but can't remember what happened 3 minutes ago. Yet, if you ask that same patient about that 3-minute experience 5 days from now, they might remember it, even though they didn't know it then. So I think it's a really exciting area of research that needs to be further investigated.
More research indeed. Dr. Borenstein, much of the research and many of the medications we just talked about also could help in the early stages of Alzheimer's. But is there anything to help those in the later stages?
That's still a work in progress. The fact that we have the blood tests that were described earlier on is a game changer, because it used to be that for the most part, we'd make the diagnosis by excluding other conditions. We now can proactively make the diagnosis, and that will allow more people to get treatment sooner. And we heard about the hundreds of protocols taking place with hundreds of medicine, that's going to increase. And it's going to really make a difference in where we are in terms of potential treatments that could be individualized for each person.
Thank you, Doctor. Jay, how does the care for Alzheimer's change when they progress, let's say, to the later stages of the disease?
Sure. Early on care, assistance with activities of daily living, maybe just simple cues or reminders. But as the disease progresses, they need more and more assistance, and so it may become hand over hand assistance with eating, for that repetition, bringing the hand up with the food to the mouth. And then as it continues to progress, it may advance to someone needing total assistance with feeding, for example.
All right, thank you, sir. Dr. Las Mesas, I have a viewer question from Alicia in Miami. And Alicia, thank you. She is asking, what is a hallmark symptom? Something that says we absolutely need to take our mom to the doctor for evaluation. I hope I'm saying this correctly. I'm a little confused about that.
So a hallmark symptom means it's a symptom that's very characteristic of the disease and that brings the attention of the doctor that the person should be evaluated for this disease, for example, by taking a blood test or taking, brain imaging, or so to do, further investigations.
And what's an example of one, please?
Memory decline.
Memory decline. Okay. Thank you, doctor. One way many people reach their loved ones with Alzheimer's and other forms of dementia is through neuro-arts. It's so important. Psychology Today defines neuro-arts as an emerging field of scientific research that studies how the arts and aesthetic experiences change the brain, the body, and the behavior. Dr. Borenstein, what's the connection between the arts and the brain? And also, what is the effect, or what effect do the arts have on the brain?
The arts are extremely important for all of us, but in particular for somebody with Alzheimer's disease. As we were describing, sometimes older memories are there, and memories of music that people might remember, that's something to enjoy together. I'm curious if Kitty's able to listen to songs that her and her mom have liked over the years as an enjoyable activity for the two of them. Sometimes going to a museum and seeing the art together. It's a social activity and an interesting activity. So there are ways to really stimulate the brain and help the person above and beyond the normal interactions that we have.
Kitty, let me ask you, have you tried listening to music and newer arts with your mom, and do they do that also maybe at the daycare center?
They do. They listen to Motown, which is always her fave.
Love it.
Yeah, Dirty Dancing and Give Her Ice Cream. That's like the highlight of the evening. So I'm learning to, try to hit those sweet spots. I call it the 80-20. I mean, 20% of it, I get her back, and then 80% is the other person that I've got now. But yes, I'm learning to try to bring her back to a time where it was pleasant for her, because she always referenced to, I want to go home. I want to go home. I'm like, you are home. But the home that we're in now is not her home. I'm learning all of that. But definitely music is therapy for both of us, and headphones too.
Yes. And Motown, absolutely. My favorite too. Jay, also, same question. At the Memory Center, how is this used, and how important is it?
Continuing along the lines of music, we include music daily in our programming at our Memory Care Center, and it is really amazing to see residents who maybe are not very verbal, as they engage in the music and they start to move to the beat. And,
you start seeing improvement?
Oh gosh, without a doubt. You begin to see glimpses of that person and the enjoyment that music, the movement, the beat brings to them. So music is a big part of our programming, and it really, really is an important part for residents with Alzheimer's and dementia.
That's great. I love that. Dr. Las Mesas, are there ways to track the changes in the brain and to see the response to the neuro-arts?
There are actually several ways to do that.
Really?
One is, for example, functional MRI that measures the blood flow in different brain areas, and the more the brain is active in that area, the more the blood flows there. Another one, but the temporal resolution of that is not very good. So there is one that has a millisecond resolution and tells you, hey, there is electrical activity here. It's simply the EEG. And there are even, headsets where you can see your brain activity in 3D. And then there is also functional near-infrared spectroscopy, which measures oxygen saturation in different areas of the brain, where you can also where there are also portable devices. So there are different ways to look at that, and it's very neat.
It is. And doctor, I don't know if you've seen that video on YouTube of the ballerina who's just sitting there, and she all of a sudden starts hearing the music, and it's just amazing to watch. You know what I'm talking about, right? Does that happen? Can that happen?
Well, with Alzheimer's disease patients, I don't have the experience of that. Maybe one of my colleagues has
Dr. Galvin,
seen it
your
happening.
Thoughts?
I haven't seen that a direct example, but people who are living with disease can lighten up. My grandmother's 104, and she lives in a long-term care facility, and she enjoys visiting with her family, but boy, you put out music and she starts tapping and it's a different person. So I think that this can make a big difference for a person living with disease.
Absolutely. And Dr. Galvin, how can family members also of Alzheimer's patients use neuro-arts to help their loved ones?
Well, the idea is to keep your brain active, right? And so it could be art, it could be music, it could be dance, it could be coloring. But it could be anything, right? So reading to someone. So it's really engaging someone. There's the social interaction. There's the cognitive stimulation. Those things can have important effects on mood and behavior. They don't really directly help with memory, but they improve the quality of the life of the person who's living with disease, and it'll improve the quality of life of the caregiver as well.
Great information. Kitty, I want to ask you something. What do you wish you had known about Alzheimer's when your mother started showing signs of the disease?
How many resources are out there? Because I think her and I would have gotten help a lot sooner. I didn't realize that there was, things called day camps. I didn't know that, senior people had places to go 8 to 5, Monday through Friday. There are also drugs that are out there that can help. My mom has tried a couple of them that, of course, there's no cure, but it delays it. And so had I known a lot of this sooner, I would have gotten the help I needed, because at one time, I think I felt like I was going to scream every day. I was up against the wall. I didn't realize that there were centers that can give me some time that I needed. They call this the long goodbye. And so it's the hardest disease that anyone can ever witness. So I think getting those resources early, listening to shows like this, Googling, getting into help groups, get the resources as soon as you possibly can, so you will be able to help your loved one better.
Very, very true. Dr. Borenstein, following up on what Kitty said, do you think there needs to be more education about Alzheimer's and just more awareness to help people like Kitty and those that maybe think, okay, it's not going to happen to me, but then all of a sudden it comes knocking on your door?
There needs to be shows like this. There needs to be education so that, number one, when facing the situation that Kitty and her mom faced, they know where to go and what to do. And the Alzheimer's Association is an extraordinary resource. And I think an important part is caring for the caregiver. There's support groups that are available that make a big difference for the caregivers. So you can't help your mom if you're not taking care of yourself also. So that's extremely important. And then the other thing is that we can control this to some degree with the lifestyle changes, with proper diet, with exercise, controlling blood pressure, cholesterol, diabetes, etc.
Thank you, Dr. Borenstein. Dr. Galvin, I have a question here from Ellen in Hallandale. Thank you so much, Ellen. I love this question. I've done puzzles for many, many years. My mind is strong. I'm 93 years old. Did the puzzles help? Well, first of all, wow, Ellen. I can't even do one, so I'm going to start doing puzzles.
So any brain activity is going to help. So if you like puzzles, do puzzles. If you like music, listen to music. But what I would say is the brain really likes to be challenged with new things. So if you read a book, that's great. Next step is join a book club and discuss the book, right? If you like music, listening to music is great. Try playing something. It does not, you don't have to learn the piano, but play, clap, tap along, drum circles. So anything that stimulates the brain is going to be good for you.
And I do want to ask you the same question I asked Dr. Bornstein about education and awareness. Do you think we need more?
Absolutely. As a physician, an educated consumer is my best customer, right? That is the family that can come and recognize some of the early signs, can bring the person in who's living with disease earlier. I can do more for people at the earlier stages than I can at the later stages. So the more education there is out, the earlier the recognition will be, the earlier we can make diagnoses and start some of these new treatments.
Absolutely. And Jay, your thoughts here as well?
Same thing. The more education, the better for everyone, for the patient, for the caregivers. I don't think there can be too much education, and certainly there are so many more people out there like Kitty and her mother who wish that they would have asked the questions, who would have had more information available to them to help them earlier on. So I encourage everyone to seek out those resources.
Thank you, sir. So as we mentioned earlier, Alzheimer's isn't the only type of dementia. And while Alzheimer's is the one that affects the most Americans, there are other types. Take a look at this. We also have Alzheimer's, which is vascular dementia, Lewy body dementia, frontotemporal dementia, and mixed dementia. So Dr. Galvin, let me start with you. I know you deal with a lot of patients with Lewy body dementia, which you see it right there, the third one from that list. Can you tell us more what it is?
So it's the second most common degenerative cause of dementia, although vascular dementia is more common in total numbers. Unlike Alzheimer's, it's more common in men. It's a mixture. People will have some signs of Parkinson's disease, slowed movement. They can have visual hallucinations. They fluctuate from moment to moment, and they can have an unusual disorder called REM sleep disorder that's acting out their dreams. Affects about 1.5 million Americans.
All right, Dr. Las Mesas, I'd like to touch upon vascular dementia. I was reading here it's the second most common form of dementia. What causes it?
So what causes vascular dementia really is a reduced blood supply in the brain. It can have different causes. It can be a heart condition leading to the heart pumping less blood to the brain, or it could be that the blood vessels have an underlying condition, so the blood vessels don't supply enough nutrients and oxygens to the brain. The brain is a huge consumer of oxygen, 20% of our body, when the weight is only 2% of our body. And so the way to treat vascular dementia really is to treat the underlying condition. Diabetes, high cholesterol, atherosclerosis, and also to do some cognitive stimulation.
Okay, thank you, Doctor. Dr. Bornstein, I also want to talk about frontotemporal dementia and the difference from the other types of dementia, if you don't mind.
Yeah, often this type of dementia really begins with some of the behavioral problems. So it can often seem to be like a psychiatric condition. So if somebody's experiencing that as a new onset in particular, that's a time to seek medical evaluation.
Thank you so much, Dr. Bornstein. We are about almost out of time. I would love to get final thoughts from everyone if time permits. Dr. Galvin, maybe a few thoughts from you, please?
Sure. You've heard a lot of great information today. Stay mentally active, physically active, eat a healthy diet, control your medical conditions. The fact is that you can build a better brain as you age.
Thank you so much. Dr. Las Mesas, what about you?
Yes, so my thoughts are there's definitely something that can be done with lifestyle interventions, and I hope that you all people who are listening to us will do that. Please do it. But I also would like to stress out the importance of research and medicine. This is what has taken humanity to win huge battles against major diseases, and we're fighting this battle now. We're going to get to the point where these diseases will be preventable.
Thank you so much, Dr. J.
There is so much support available, whether it's in the home for caregivers, family members, as well as in communities such as memory care centers. So I just encourage people to reach out. They're not alone.
Thank you so much. Dr. Bornstein, we have a few seconds, if you don't mind, final thoughts from you.
I agree with all of the above, and I would say People shouldn't suffer in silence. Get help.
Thank you so much. Kitty, I'm leaving the last word for you. You've got about 20 seconds.
Well, either you're going to become a caregiver or you're going to need a caregiver. Just please make sure you get the help that you need and you're not alone. We're all in it together, and hopefully one day we will find a cure. That is the last prayer for me, that we find a cure for this horrible disease.
Amen to that, Kitty. Thank you so much for sharing your personal story, and thank you to our panel and to everyone in the audience for joining us. We hope this town hall answered some of your questions and provided you with new and hopeful insights. We can never lose hope. I'm Olga Villaverdi. See you next time.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.